Okay, I think it's time to start. Welcome, everybody. Thanks for joining us. This is the second issue of Patient Engagement Travels. My name is Estelle. I am a patient myself, and I work at Infinity Communications. We're a health communications agency based in Geneva, and we are keen to help you learn about patient engagement. We've got a wonderful episode planned with a very inspiring pair, a patient and a researcher, and they are going to tell us about how they work together on this landmark BRIGHTLIGHT study. And they will tell us about how their relationships have grown over the years from strength to strength. At the end of the webinar, afterwards, we'll send you the resources, and we'd also like you to stay online for a little poll for a couple of questions for us. So, first of all, I'd like to welcome Maria Lawal, who is our patient advocate, cancer survivor, and expert. She's also a best-selling children's author, a medical hair loss, wig, and beauty consultant. Wow, that's a wonderful and creative portfolio of achievements. Tell us a bit more about yourself, please, Maria.
Thank you so much for the introduction, Estelle. So my name is Maria Lawal. I was diagnosed with osteosarcoma. So osteosarcoma is a rare type of bone cancer that affects young children and adults. So I was diagnosed when I was 15 years old. And then 18 months later, I relapsed again in both lungs. That was in 2010. But thankfully, through chemotherapy and surgery, 13 years later, going strong, I am, remission, thankfully. So back then, so I was 15 years old, I wasn't really much aware of the terminology patient advocate, but I did used to get involved in quite a lot of like monthly meetings with a lot of the young people that I was treated with when I relapsed under teenager, young adults. When I was given the opportunity to get treated at a teenager, young adults unit, being surrounded by other young people my age, going through a similar experience, as opposed to be treated on a children's unit. So on the teenager, young adults unit, we would have monthly meetings where we just discuss issues about things that we didn't enjoy about, our treatment and whatnot. So that was kind of my first exposure to what patient advocate is and patient engagement and research. So that's a little bit about myself, and I'll explain more as we go along.
That's wonderful. Thank you. So from very early on, you've been sharing your lived experience to help research and aid other patients in their experiences. Now, let me introduce Rachel Taylor, who is also a powerhouse. She's director of the Center for Nurse, Midwife, and Allied Health Profession Research at the University College London Hospitals of the NHS Foundation Trust. Tell us a little bit more about yourself, please, Rachel.
Hi, Estelle. Yes, hi. So I'm a nurse by background, but I started on a research career back in 1995, and I was working with a children's liver team down in King's College in London. And as part of this developing as a researcher, I developed an interest in patient outcomes and the experiences of care. And I'm really interested in how we deliver services and how that impacts on these outcomes. And at that time, my interest was really in definitely with young people, sort of adolescent age, but with liver transplants.
I see that you've had young people at the center of your work from right from way back when. And tell us a little bit, before we talk about the methodology and how you work together, you and Maria, can you step back a bit and tell us about how you learned about the need to integrate patient and public engagement in your work earlier on?
Yeah, so I was introduced to this concept back in about 2009. PPI at that time, that was a new thing. It wasn't common, but I started working with a team here. So Lorna, the lady in red, and Jeremy, the chap with glasses on, and the suit. They'd really embraced this idea of patient and public involvement, and brought this idea to the study that we were working on. And there was some resistance at that time about patient and public involvement. The idea that it was going to take more time, that research could be worked faster, that they could just get their publications out more quickly. And the idea that patients don't understand, this viewpoint that patients don't have that level of intelligence. So when I was awarded my PhD in 2008, like I said, I came to work with Jeremy and Lorna, and we started working together to do the work that would then become BRIGHTLIGHT. Jeremy and Lorna at that time were working for the National Cancer Research Institute, and the National Cancer Research Institute always involve patients in the work that they're doing, and they usually have one or else two patients in the group. But Jeremy and Lorna felt that actually young people, the work that they were doing with teenagers and adults with cancer, that they wanted a more extended model. So they had 5 young people who formed what they called the core consumer group. And really, this is the first time I'd ever heard about patient engagement and involving patients in research. And a lot of the work we did with the core consumer group at that time, I mean, at the time, I just took it, this is what we did. But actually, it was really progressive. So, for example, if you see the image here, we did peer interviews. So we got young people to interview other young people. And then the young people who did the interviews, they worked with us on the analysis. Now, I won't say this was easy. At times, it really was like herding cats, because young people are young people first, patients second. So they came with their own ideas. Yeah. And if I have to be honest, it probably did slow the process down a little bit. But slowing it down actually was a secondary issue. It was the quality of what we had there, the work that came out. It was really, really powerful. And actually, when we look back and look at the reviewer comments from the publication that came from this, I'll just quote one of the reviewers. They said, "The manuscript is well written. Only comment concerns negativity of quotations and themes. While reading the manuscript, it seems at times that there was little positive discussion from participants." And this was a kind of revelation to me. I mean, we've been taught about boundaries all the way through nursing school. You're taught to keep, boundaries with patients. They're patients, you're the professionals. And I was a bit anxious that we were crossing these boundaries. And I don't know, this them and us perspective, I think is a really old-fashioned way of viewing how healthcare is.
Yeah, I think that's a very, very interesting point. It is quite an old-fashioned way. And we've seen really how strong peer-to-peer patient communications are, how authentic we can be with each other, and how patient engagement can really collapse these us and them type of differences and hierarchies that are quite entrenched in medical care. That's for sure. And I love how this is, I mean, it is critical, but it's really authentic. And that's obviously these citations here. It's obviously what those patients were feeling at that time, and it was real for them. Maria, can you tell us a little bit what your view is on this this peer-to-peer communication versus the patient-researcher communication?
Definitely, of course, like I said, being 15 years old and going from being diagnosed, first of all, and being treated on the children who have been surrounded by, crying babies, and how that was dealing with that emotionally and physically. But I was just so grateful to having the opportunity to be able to have access to medical treatment and stuff. Yeah. And I didn't really think about that aspect. To then fast forward 18 months later, being, being relapsed and given the opportunity to being treated on a ward surrounded by other young people, and then us again getting that opportunity to meet on a monthly basis and being able to discuss things surrounding fertility and employment and going back to college and school and quality of life. That, for example, I didn't feel comfortable asking my consultant, or I didn't feel like that was important to her, or that wasn't made mention to me. So that was a really key defining moment for me on my treatment journey, that actually, wait a minute, it's all well and good having all of these drugs and chemo and surgery, and I'm grateful for it. But at the same time, where do I go for all the other questions that I have? And it was really supportive having that opportunity to attend this monthly meeting with other young people my age, and we're able to use our voices to voice out concerns, that things that we weren't happy with, and then being able to, for example, have monthly meetings and monthly discussions, and being those discussions being taken forward to the other meetings with clinicians. For example, when they were redesigning the teenager young adults unit, they asked for our young people's input on what we'd like to see on the ward. And we suggested in the side rooms, as opposed to just having a patient bed, you will also have a smaller bed for our partners or parents. Because in my situation, my mom stayed with me because I was 15, and bless her soul, she literally sat on a chair day and night, Monday to Friday, every single day when I was in hospital for 9 months, because she didn't want to leave and stay in parent accommodation.
Yeah.
And I felt bad. I would say, Mom, go home. And she wouldn't want to leave. And I didn't want her to leave, but she was uncomfortable. But if the bed was available to her, I would feel better and she would feel better. And that wasn't a medical thing, but that was a social or quality of life thing that would have really made an improvement in my treatment journey.
And you were able to give that feedback, that
exactly,
a bed for your loved one next to you would have been really a big help.
Exactly, and then to see that being implemented when they were actually redesigning the wards to actually put the beds in place, you know, it made a massive difference. Thankfully, I didn't need that anymore. But for future young people that will unfortunately be diagnosed with cancer, to know they have that support and they have that help put in place, you know, it goes a long way. You
made a big change for other people to come up to you. That's a kind of lived experience and expertise that comes from patients, definitely. So Maria, tell us a bit about how you got involved in the Bright Light Study. What led you to it?
So moving on from the monthly meetings on the young Christians ward that I was being treated on, the youth coordinator saw that one, I had the loud voice and I wasn't afraid to voice my opinion. So she brought to me that there was a group of researchers based in London, and they were looking to speak to young people to get involved in the onset of branding their research study. So I was just like, oh, another opportunity to talk. Yes, why not? Taking, I had no idea what to expect. So we went for a 4-day workshop in London, and then it was so encouraging to see and hear from the researchers that they wanted to hear from us but know the nitty-gritty. And we were involved in things like designing the study logo, you know, choosing the color schemes. And one thing that really stuck out to me was when I want to get involved with a study, you know, and the nature of what Bright Light was. Bright Light was meant to represent a hope and, you know, new beginnings and you know, a change and a movement. So, you know, for the researchers to give us the opportunity, even things as the color that was, you know, not necessarily important, but towards young people, I felt like if I wanted to be involved in a study, even the name has to be a motive, has to move me in a certain way. Yeah. And they understood that, and the research, Rachel and Lorna, they were fantastic at kind of allowing us to bring our inner creativity, which was very good. And I thought it was a change in the right direction for something better to come along.
And it's fantastic. And it's such a wonderful paper, because it really shows the methodology that how other researchers and you work together in this incredibly creative way with branding, with logos, with names, which was really amazing. And Maria, how did what was the knock-on effect later on with your youth involvement? How did that affect the study, for example, the retention of participants?
So yeah, another key thing for me would be I love going to this meeting, but similarly with what happened with the beds being implemented, I wanted to know, yeah, I'm not just having a talking piece. My opinions would be taken on board.
Yeah.
So it was a great thing that what Rachel and the team did, they would update us with like a quarterly newsletter. And it was great to find out that with the recruitment and the retention of the study, from having us young people come on board and give our opinions, contributed to real change. And I remember one of the figures being, the recruitment and retention rate went from 30% to, when we came on board as young people, went up to 60%. And if it was real nice to know that I'm speaking things and saying things, but it's actually been implemented and things are actually happening and positive change and solutions are being created. So it was really empowering to know that my voice is important, and it is important to tell other young people or other people that are going through chemo or cancer or whatever illnesses they have, to be vocal about their experience, because it does contribute to real change if the clinicians are ready to listen.
Yeah, it's phenomenal. It really is. That's an incredible achievement. And hats off to you for doing it, and to the researchers for being open to that and willing to do it. So I want to raise this tricky question with you, Rachel. How did you handle and how do you handle the topic of paying patients for their work, for their expertise and input?
Yeah, we have national guidance in the UK about paying patients for their time to be part of research. There's an organisation called Involve, and they have very specific rates on what you should be aiming towards for certain things. Lorna, when we first started, the guidance wasn't there, so it was very vague. And Lorna, when she looked into it, there was some concerns that if we paid patients or our young people with cash or just money, that this could potentially impact on their social security benefits. So we introduced a voucher system, which is it's great now, because you can just do an online link. Our young people can just decide whatever they want for payment. So if they want something serious, like they need petrol, they can get for a supermarket store, so they can do it that way. But there are occasions when we don't have money, because you need to have a grant and have it costed in. So when we're developing a new study, that is actually when it's really important to have patient representation. So for example, Maria is a co-applicant on a lot of the work that we're doing in sarcoma, which is a rare cancer of connective tissue. So we need her input massively to tell us about whether the methodology is right, whether we're pitching the text right. And so Maria's never had an issue with this. She's inputted it into all our grants, all the work that we're doing. And Maria's not dissimilar to a lot of the young advisory panel. They're all happy to be involved in that, because I think it's because they see we're not being tokenistic, that we really want young people's voices in everything that we do. And also, when we do get grant income, we don't just cost them for their time. We cover the cost of their travel to come to London or wherever we're holding workshops. We make sure that we have adequate refreshments there, accommodation if it's going to be an overnight stay. And one of the things that we've learned is that young people like to have the time to be together. So we always make sure we can cost in, for example, time for a meal, so they can have that quality time with just them without us there. And we always try to get feedback from the workshops that we're doing, because it's important to us that when young people are giving us work, giving us their time, they're giving up time for us, that we get feedback and we act on it. And I just think of one of the just going to quote one of the young people, and with one of the feedback we got, the events just get better and better each year. You guys actually take suggestions on board and improve accordingly. And when you get feedback like that, all the effort that it takes into planning a workshop and bringing young people together, it's really worth every second.
That's amazing. It must be really satisfying for you and for them. And that's what a partnership is. I mean, and that's what we aiming towards with all of this is partnerships between researchers and patients. So Maria, can you tell us a bit about some nitty-gritty of what you did in the Bright Light youth group?
Yeah, definitely. I remember one of the activities that we were asked to do was in terms of like looking at the Bright Light logo and why we picked that specific logo. And one of the suggestions that I came up with was, for example, us young people are always out and about on our phones and whatnot. And like I said, Rachel and the team always send out monthly newsletters. So, for example, when we looked at the logo, when the logo came up, or an email came up, and the name Bright Light or the name of the study came up, I didn't want a situation where I'll be, you know, with other friends or even work colleagues, and so their name would be triggering over something related to cancer that everybody would know about, the people around me will know about. And in case I was uncomfortable sharing that. So to be able to bring that to the team, and the team were interested in things of that, I think that's the key point, that they didn't just overlook something as little as that, to be able to say, oh, but it's just a name. Yeah, it's a name, but I might not be comfortable, or I might see the bright light and think, okay, where I am right now, you know, I don't want to open that particular email, I don't want to open that particular newsletter. But if someone was to walk past and see the name Bright Light, it doesn't automatically scream cancer if they're in the cancer networking. For the team to take that on board and, you know, make sure that was the thing that was recognized and it was implemented again. It showed that we weren't just a talking piece. They were listening. They wanted to know our where we're coming from and the reason why we got what we're saying. Yeah, definitely.
That's really a very good example. Small thing, but really important. Okay, and I saw that you had these photos of what looks like people playing Twister. Can you tell us a bit about what's going on here? Let's see. You tell me, Rachel, from the research perspective.
Yeah. So the original goal of this workshop was to try and create hypotheses. So this is kind of a complex word to basically say trying to find causal relationships between two things. The Bright Light, we've got a lot of data we've collected from patients, from notes and from the NHS databases. So we wanted to get young people to start thinking about what we could do as secondary analysis. And Lorna is the creative part of the team, and she likes to do things that will be really fun. And the idea of just like, let's write some hypotheses is quite a complex thing and not very interesting at all. So she came up with this idea to try and make it fun. I don't know if you're familiar with Twister, but you spin a wheel and it directs you to put your left or right hand or foot onto one of the coloured circles. So we added a section of data into each of the sections of the wheel. So after 2 turns, we would then have a discussion on how those 2 bits of data might be linked. So for example, where you live, how that impacted on how you feel. And that discussion would then become the research question that we were asking.
Wow, that's really, really innovative. That's incredible. And Maria, how was it for you doing this? What memories do you have of this?
Those pictures definitely bring back memories. I don't think I'm that flexible anymore. But again, it showed you the willingness that Rachel and Lorna and the team, and the extent they were willing to go to really think outside the box, and they were willing to show us young people they wanted us to get involved. Because then again, as well as being patient advocate, we also had our limitations from experiencing chemo and life and mobility, and so not all of us could get on the floor and physically do the movement. And we suggested that, you know, Rachel and Lorna and the research team, they like kind of took over our place, because Twister can be quite a long game, and you know, we all had different opinions. So we suggested that they kind of take over. So at one point, Rachel and Lorna and the other research team actually kind of took over, and they were able to do our movements for us and it was so fun and relaxed. And it just opened up the group a little bit more to be able to share ideas and feel comfortable talking about things and pushing boundaries and things that we did discuss. So it just shows another angle of how they were open to bringing patients on board, and that how that would allow us patients to open our creativity and not be afraid to speak about.
Amazing. And change again that kind of traditional hierarchy between researchers and patients. So that's really it's really cool. So what I want to just focus on a little bit is this novel publication. Now, I know there've been several publications, but what really stands out in patient engagement is this one where you're talking about exactly this this methodology that you did. It's made a name for itself. I know this. A researcher said to me, I know that one. I've seen it. It's amazing. So tell us, Rachel, a little bit about the study standing out like this for you.
You know, it's funny that you say that this is a landmark, because to me, this is just something that we did. I mean, as I mentioned before, we've been working with the National Cancer Research Institute called Consumer Group. Actually, we wanted a group of young people who was specific just for BRIGHTLIGHT. So this just seemed like a way that we could get everybody to work together. There is something about when you work creatively together in a confined space, you build up this relationship. And Lorna just happened to know somebody who worked in health marketing. So Jazz came in and did some pro bono work with us to use the using methodology that they have in health marketing. And I mean, it was really important for us at this time to have something that was so in your face, that people recognized, because it was a longitudinal study. We wanted the name to last, and we wanted people to be able to identify with. But I think actually for me, the most important part of this work was that it built us as a team, and it wasn't just young people. It was some of us hadn't really worked closely together before as researchers. So it was establishing that research group, so the professional researchers alongside what came the young advisory group, advisory panel. So that's the YAP, and they've really become kind of researchers alongside us. And I also look at this, I think about that workshop a lot, because one of the key things that did it for me was we brought in a load of art stuff to do with that. And one of the researchers had said, you know, you really need to think about age appropriateness, because a lot of the stuff in this box were not just for young people. We'd done some work with children as well. And partway into the workshop, I just had to look at Faith and say, you know, Faith, it's going to stay with me forever watching two 20-year-olds fighting over blue glitter. You know, I think we all need our inner child somewhere. And I think we've just expanded from that, because then, as you can see with these now, that we do try to bring young people into the publications, because they are part of our research team. They're not just patients anymore. That's
phenomenal for a person to be to go into a co-publication role. I'm going to jump forward a bit and ask you, Maria, what else followed from your involvement in the BRIGHTLIGHT study in your life, or as a patient advocate, let's say?
So I've been lucky enough to, you know, co-chair a few meetings with BRIGHTLIGHT, but also, as you can see in that top one, October last year, I was given an opportunity to give a speech at the BioNow conference, which was a conference with quite a few pharmaceutical companies and you know, clinical trial companies, and just talk about the importance of patient involvement earlier on in research and the positivity that brings to the team, that we also have a voice and we understand that, yes, it's good to do clinical trials, but involving the patients at the beginning will make a difference, because if you implement the things that we say, it gives that room for positive change to begin to get a wonderful outcome. So I'm also, for example, I'm part of the sarcoma board at my local hospital, the Christian. So it's gone on to open many opportunities, because I'm an ambassador for a cancer education organization that work with the BAME community in terms of educating the BAME community on the importance of going to your GP and, you know, getting checked out and asking questions and being comfortable in the uncomfortableness of asking these questions and where to go to. So it's definitely opened up a lot of opportunities for me to sit on quite, you know, important places.
And
also,
yeah, tell us a bit
example,
about the James Lind Alliance that you've done.
That was also an important one, being able to go down to London with top clinicians and other patients and having the opportunity to create certain priority questions that would then go on to be researched in what we thought was important, like quality of life, unemployment, fertility, when is the right time to talk about fertility to a young female or a young male on treatment, and sexuality, and what does life after treatment look like as well, and things of that nature. So it's allowed me to go on to, you know, speak with clinicians that I would never have had opportunities to and give my opinions.
That is absolutely amazing. I mean, and the James Lind Alliance, those priority setting things are very respected in this area of engagement. I wanted to also talk a bit about how you've been recognized over the years for this. I just want to check if I didn't get something. Sorry. Okay. Let's talk a bit about the recognition for the study, Rachel. Can you tell us a bit about this? I see that you've done, you know, you've been awarded, yeah, they've been bright lights for the BRIGHTLIGHT study.
Yeah, I mean, I think involvement's been instrumental to our reputation as researchers. I mean, we won our first award at the National Cancer Intelligence Network Annual Conference for Patient Choice of the Poster Award. Later in the same year, patients voted for our stand at our hospital research open day as the best stand. We were finalists for the RCNI Awards in 2019, but 17, but we didn't win that one. But on our second attempt, it's here, you can see it, in 2019, we won. We created a performance out of Bright Light, and so in 2017, it was shortlisted for the Manchester Theatre Awards. And then in 2019, we won the Innovation Award at the PROMS UK Annual Conference. And the Bright Light YAP is known nationally. They've contributed to more than just Bright Light and our own research agenda. So they represented young people at the National Institute for Health and Care Research and a TYA summit on increasing access to research. And they've also advised for the NHS has something called DigiTrial. So they've been advising on that initiative.
That sounds interesting, DigiTrial. Everything's all about digital engagement these days. And what I wanted to ask Maria about now is how has your identity developed over the years resulting from your involvement in Bright Light and similar type of work?
So the one thing that I remember specifically was when I was in treatment, you know, and I would have certain pains or things that, and I would tell my mom, because my mom was the person I trusted, and my mom was who spoke to the doctors on my behalf. And then after a certain while, she would say to me, Maria, you need to use your voice to tell the doctors and the clinician what's going on, and you need to keep telling them, because they're not going to listen except it's coming from your mouth and it's your experience, and then they're going to have to make a change. And that's one thing I've carried on with me throughout this whole journey, and discovering myself, and luckily having that opportunity to partner up with Rachel and the team, and being able to go to all these different conferences, is the importance of patients using their voice and their lived experience to share with the clinicians, because it's all well and good having the clinicians and the trials and the drugs, but if the people you're prescribing this to are not voicing feedback, or they're not implemented at the early stages, there's no point. And then the wonderful quote you put up, excuse any Nigerians in the house, my pronunciation isn't great, but it says, and And then literal meaning, as I said, what lies out of reach, but by working together. So basically it means, you know, no matter what is out of our reach, we need each other to work as a community to come together. Because right now, on one side, I feel like you have the patients like me with the voice, ready to voice our opinion, negative or positives, to improve outcomes. And on the other hand, you've got people like Rachel that want to get people involved, and there's this bridge of uncertainty, and we need to come together and find a way to merge those things together and create wonderful outcome for the future.
That's really beautiful. So shout out to all the moms out there. Thanks, moms. And to your mom who sat by your hospital bed in a chair. Yeah, that's really beautiful. Thank you for sharing that with us. And then we got like a couple more minutes left before we get to questions, but just tell us a little bit how else your identity has developed, Maria, since this event in your life.
So another important one, as you can see in that picture, I'm a new mom to a 2-year-old, which is a wonderful experience as I go along. But again, relating that back to my treatment and being a patient advocate, it's the importance of using your voice as a young person to voice your opinion, even as an adult. So what I do, and the inspiration behind my book and what was my young child and myself, and if we can teach young people at a young age and even adults the importance of using your voice and the importance of using positive with affirmations to, you know, to speak into your surroundings and your environment, and how that can improve your quality of life, your mental health aspects, and moving on in the future. And that's what my book, The Daily Mantra, is about, which is available on Amazon. And also from my lived experience as a young person, again, going through chemo and experiencing the lack of diversity for young African Caribbean females going through hair loss, and the lack of variation of wigs and hair textures and curly afro. That also inspired my business called Ademi, which is Yoruba for the English pronunciation means my crown. Literally, your hair is your identity. And one thing Rachel can testify is you can never catch me with the same hairstyle or the same color. So I make unique colored wigs that I color myself. I make with my hands, and I gift and I sell to young women and girls going through treatment to be able to have, at least you're going through this treatment and it's the worst thing you can imagine, but I want them to wake up and look in the mirror and see a survivor. I want them to look in the mirror and see a champion and be able to voice their opinions, to be able to feel good, you know, amongst everything else that's happening in their life. And hopefully through that positive experience, they can feel confident enough to share their experience with the clinicians and the social care teams and the social workers and youth engagement people that will come across.
Yeah, I mean, if you have that gorgeous purple wig on your head, it gives you a little bit of extra confidence to cope with this very difficult situation that you're going through, right?
Yes.
I think that's wonderful. That's so creative and fantastic. And I'm sure we all need your daily mantra, no matter what we're going through. So, okay, so now we're going to open up for some questions. We just got a few minutes left, and then after that, the poll. What else are Maria and Rachel working on in future? What are you up to, Maria? What have you got on the horizon?
So with the Bright Light team, as I said, you know, Rachel and Tim can't get rid of me now. I'm literally a part of the team, and you know, it's a really good feeling, and it's a testament to the hard work they do, and as well I do as a patient, to be able to go on from just being on the advisory panel to actually now being a team member or co-applicant on a few of the researches, such as the SAM appraisal measure. And we're also working on, you know, the fear of reoccurrence and other studies that were in the works, and it shows the trust that we've built up over the years. And then it just goes where, because Rachel and the team actually bring me on, and I'm involved in reading the patient information sheets and the consent forms and,
that's
you know,
brilliant.
little things like, are the words being used, are they triggering, are they just scientific jargon, and when is the right time to introduce a research study to a young person? Is it at the beginning of the trial, at the beginning of diagnosis? Is it at the end? And also, who is introducing the child to the young person? Is it a youth coordinator they trust? Is it a nurse specialist? Is it a consultant? And how is the person presenting this information to them? So all those little things that might not have been thought about by the research team because they're busy researching, someone like myself as a patient will be able to take a step back and say, oh, maybe a youth worker can bring this up at one of the youth meetings, so it doesn't feel less scary. And I'll be able to talk about, for example, a con of me joining a research would be the longevity, you know, how much would that have an interruption on my trial? Would that mean I have to go into the hospital more, or would that have to be a long 1 hour phone conversation? So little things of that nature that might not immediately stand out to the research team, I kind of give my opinions on that.
That's really a expertise that can guide researchers to develop something that will be more user-friendly for patients. And how about you, Rachel? What other frontiers do you have for patient engagement in your work?
Well, I mean, we try wherever possible to include patients as co-researchers, but you know, this is normal now to us, but it's not normal for a lot of people and a lot of processes. You know, for example, publications. We want our young people to be to be co-authors on all our publications. They've contributed often more than some of the research names, but many journals, because it's not a work email address, then put up a whole load of barriers about the fact that, well, they want a CV, they expect, you know, their expectations are just, they're different. And I just actually wonder whether one of the frontiers of the future is, you know, the research agenda is shifting more to reflecting what patients want. And you've showed me the James Lind allowance. So I wonder whether we'll get to a point where patients actually, they're the people making the grant applications and trying to lead the research. I mean, academia won't like that, but we've seen, I mean, if you look at the Sarcoma Patient Global Advisory Network, which is the European patient representation for patients with sarcoma, I mean, they've conducted on their own bats without any researcher or academic involvement some absolutely splendid results of patients' experiences of sarcoma. So we know that it can be done.
So that's something ahead, that patients might be leading research and will of course need researchers to support them, but they could be actually leading the way. I'm really, really sorry, because I know we could talk for much longer, but we need to wrap up. So I just wanted to say thank you, a very warm thanks to you both for the time, you know, your input, your expertise. It's been really wonderful. I've enjoyed it so much, meeting you and doing this with you. Thank you to everybody. Please stay on the line now to do the poll, and stay tuned for the next patient engagement travels, which is going to be the end of June. And we'll be talking about paying patients, best way to do that. Thanks, everybody. Have a good rest of the day. Thanks, ladies.
Thank you.
Bye. Thanks for having me.